People often come to couples therapy hoping that the therapist can change their partner to be how they want them to be. Couples therapy does not do that. What it does do is help people understand their differences and improve their communication about the differences. This helps them meet each other's needs better, it calms down fighting, and it gives them much more satisfaction in their relationship. Couples generally seek therapy when they're having communication problems. Sometimes they come for premarital counseling. People may come when they're on the verge of separation or divorce, and sometimes therapy helps them to decide to separate, and sometimes it helps them to come back together. When they're feeling alienated, having sexual difficulties, when they're having difficulties with their children. All of the many things that face couples in life can become problematic, and that's when they come. Well, often couples come to me saying, we have communication problems, and that's usually very accurate. When people are together, they have a very good understanding of each other pretty quickly, but sometimes they use that understanding to upset each other rather than to make each other happy. And so we try to understand what the signals are that will produce better reactions between people. Having a professional therapist in the room with a couple who's having a hard time is enormously helpful. It serves a number of functions. One is there's a witness. There's someone who can say, I see this is what's going on, and give some reflective feedback to people. It also helps to have someone who has the skills to identify what some of the problems are, and then to mediate the disagreement and arrive at a common understanding of what would be good for both people. Another advantage of having a third person in the room with a couple is that when people hear their mate relate their stories to another person, they have a chance to hear it differently. And sometimes that allows them to reflect on it and react to it differently.